And welcome back to Sullivan's Unheard Voices. I'm here with one of my favorite people, Dr. Jami. Dr. Jami, please introduce yourself.
Hi. So I'm Dr. Jami, short for Dr. Jami Heyting. Usually people butcher my last name and call me Hating, and I'm like, I'm not a hater.
I
So
love
I
that.
just go by Dr. Jami. Um, and so what I'm a doctor of is I'm a naturopathic physician. I got licensed back in 2016. And I don't know if you want the backstory around like what led me to this career,
Please. I
but
think it's important. I really
okay,
do think
yeah,
it's important.
sure. So my original, I know, I'm like, here's my life story. Not okay. Here's where my ADHD part of my brain comes and goes.
Right?
So as a kid, okay, I'll do a little bit of it. As a kid, I had an injury, got in a bike wreck, and hurt my wrist. Went to PT for it. Originally was interested in doing that for a career. And so like went through undergrad, went to the University of Oregon for undergrad, did their exercise physiology program, got disenchanted my senior year, going trying to finish that up. Because it was so athletically oriented, which makes sense, right? In retrospect, of like University of Oregon Ducks, right? Like everything's about athletics. And so it's changed my major, pissed off my hopefully I'm like, hopefully I could say that word. Made my advisor upset, but I was like, no, wait, look, here and I ended up majoring in psychology. Um Anyway, fast forward. So I applied to PT school. I only applied to one school. It was the Pacific University here in Oregon. They take a cohort of like 32 students each year. And so you basically have to have a 4.0, right? Like it's essentially like Ivy League level
Kind of
competition.
competitive, right?
Yeah, which is like, you're like, okay, well, this isn't Yale, but okay. And there was a number of things that happened during undergrad, yes, including my neurodivergence, but also uh, I there was family related stuff where other folks in my family were dealing with mental health issues that I was supporting them through, and so uh, ended up impacting how I was doing in school. And so I finished with a 3.1 GPA. Oh my gosh,
I know,
devastating.
right?
So low. And anyway, so didn't get into that physical therapy program. And so then I was like, oh my gosh, what am I going to do with my life? Um, my mom talked me into applying for a job at the state hospital. She's like, use your psych degree. Come work with me. And she was working there at the time. Um, and so I did. And anyway, at one point there, I gotten sick. I like got ended up getting like these recurrent sinus infections because your immune system's shot because you're like in this, you're in an institution, right? And everybody, you're so short staffed, everybody's going to work sick. And anyway, so all of that things going on. And then, uh, I was seeing a conventional provider myself at the time, like a nurse practitioner or something, on antibiotic after antibiotic after antibiotic. Uh, Also, didn't have the most supportive uh, um, supervisor at the time. Was like on my, breathing down my neck to get it under control. So I had a coworker that was like, "Did you have you should go see a naturopath?" And I'm like, "What's that?" And so they gave me the background info about, well, so they're doctors, but they're also trained in, like, yes, they know how to prescribe meds, blah blah blah, but they're also trained in like nutrition and all these, like all these other modalities, and they also like are about getting to the root cause of what's causing your issue in the first place. And so I was like, oh well, like why haven't I heard about this yet? Yes, I want to go see this person because that makes way more sense than just like treating my symptoms that keep popping up. Because it's like, why does this keep coming back? And so, found out like, oh, yes, okay, you have these sinus infections, but also look at all these food sensitivity. I got tested for food sensitivities and like, so I cut a bunch of stuff out of what I was eating for a while. And it calmed things down, calmed down the inflammation, uh, calmed down, right? I didn't keep getting infections, didn't have to get sinus surgery like what was getting, like that was like the next step on the other side of things. And I was like, surgery, or yes, I have to work a little bit harder to make sure I'm monitoring what's I'm eating. But anyway, so then that I was like, oh my gosh, this would be such an awesome job. And so then got like hyper focused on like, ooh, what does this involve? And so I had to go back and retake some prerequisites because with the science classes, they have to be within the last 7 years, and I think it'd be 9 at that point.
Okay.
And so I had to retake like general biology because I had taken that like my first year of school of undergrad. And so I just went and took it at like Portland Community College. And I was kind of like, oh, I have to retake this course I already took, but it actually, like, there's a couple benefits that came from it. I made a couple friends in the class. The class was relatively easy because I'd already gotten the knowledge and
Yeah.
just like refresh on it. And so I wasn't learning everything new again. And then I also got one of my letters of recommendation from the instructor, the professor. So that was cool. Yeah, so I know that was like the long version of like, tell us what your career is.
No, but I
So
appreciate that.
so
It,
in my practice now, largely like we're trained to kind of be like family practice providers. Like, yes, no, we're not technically board certified in family practice, right? That's like an MD specific thing. But as far as like the populations that we're trained to serve is basically falls under that umbrella. I specifically have gotten more focused with the as far as the population that I work with, and I almost said work for, and like kind of I do.
kinda,
It's
yeah.
for them, and
And
have
might I say,
yeah. Sorry,
with
go
your approach, it kind of is you working for, right?
ahead.
Because you have that level of customer service. I don't hear a lot from doctors. So I just wanted to, like, you and I know each other from, do you mind if I share how
Yeah,
we
no,
met?
I don't mind. Yeah.
So we met through a support group for adults on the autism spectrum. And one of the things that I admire every time that you participate is you're very thoughtful, you're very careful, and you're very intellectual about your responses and how you approach group. And so I always appreciate your philosophical approach, and how you approach your communication style is so welcoming for people who are neurodivergent. And I just wanted to acknowledge that because it's different. And I so appreciate the naturopathic piece because so many of the medical, how do I say this other than the solution for problems is pills and surgery.
Hmm.
That's not always the solution. And like you were talking about, it's like naturopathic doctor, you're going to the root of the problem and
Hmm.
figuring out what's causing the symptoms. And I think there's a difference there.
Yeah, yeah. And definitely, I mean, that's like kind of the segue I was going into of like with the population that I'm now working with is largely like the neurodivergent population. Um, Part of that, like, mainly is like because we're such an underserved community. But the other part I will like totally admit is that's my people.
Yeah.
Right? So it's like, oh, I know how to. It's easiest for me to communicate with people who think similarly, or like, process things similarly to the way I do, and so they don't mind my long ramblings and overly detailed discussions about things. And yeah, the other thing I will say about on the naturopathic side of things, in general, like we are the way we are taught to approach a patient visit is yes is definitely more comprehensive, and so I do spend a lot we spend longer visits, right? We're not like in and out in 15 minutes and really like, it's only half of that that's actually worth the actual physician or mid-level provider, right? There's nurse practitioners too. And the other part is like you're talking to the MA, the medical
Yeah,
assistant. And so like I'm spending the entire visit myself with the patient, and I'm the initial visit, right? Like I'm going into like all that paperwork that people fill out, right? That everybody,
yeah.
you're filling them out at any clinic, and half the time you're like, I feel like you didn't even read this, right?
Oh, 100%. Don't get me started on that.
Yeah.
I have examples, but yes. Hmm.
And so like I'm going, like I review that paperwork. Like yes, I send out a whole bundle of that, and I'm always like, I'm sorry, I know this is taxing on executive function, but also if I get this information ahead of time, I also have time to like start thinking about it when we're even like before we're even meeting for the visit. And so like I'm already going, oh okay, I need to take this into consideration, and this and this and this. And then I still like my initial visit is booked for a 90-minute slot, and like we use the most of the time we use that full time. And yeah, and there's a lot of discussion about like I go into like a lot of educational discussion about whatever's going on for the person. And so it's not just like, oh, you're dealing with this thing, oh, here's what you take, and come back in 6 weeks and we'll fix it or whatever, like we'll adjust it if we have to or whatever. No, it's like, here's what you're saying is going on. Here's all these things that I'm considering being factors in why that's going on. Here's the other things that are going on in your life that are likely impacting this. Like if somebody's got a trauma history, or they're in a situation where they're living in a like hostile household or hostile workplace or something. I know I keep like talking,
No, no,
but go
no.
ahead.
Can I pause you
Yeah,
right there?
you can pause.
Um,
Pause me.
I always like to acknowledge when I hear bits of
Mm-hmm.
information that are important to highlight, because the fact that you actually take trauma history into account is something that my primary care doctor has never done, right?
Mm-hmm.
And I have to acknowledge how amazing that is, Jamie, that you take that into account as a provider, because you're right. Like, can you talk about why it's important to you to carry that trauma history? Because it's so important. I just can't articulate why.
No, it's okay. Yeah, I chuckle because I'm like, is this going to be a whole half an hour of me talking about that topic in and of itself? And if it
And
is,
that's okay too.
hopefully,
It's
yeah,
so important.
yeah, yeah. Gosh, yeah, I'm like, where should I start about like talking about the importance of taking that into account? Is so yeah, I guess the place I want to start is like I feel like most people have heard about the ACEs study, right? Like
Yep.
the yeah. So right, adverse childhood. I think the E is for events, right?
Yep.
Like experiences, events,
I think it's
whatever.
events. Mhm.
One of those. It's a synonym, right?
Yeah.
And
I've
we
taken it.
know. Oh, sorry. Go ahead.
So I've taken it. I know I don't normally, people don't normally share their AirSys score report, but I was like one away from all of them.
Like the max, yeah, yeah,
Yeah.
yeah.
Hmm.
And my personal one, right? Like I'm open book pretty much.
Same.
Mine was pretty high, right? And so like I know for myself, right? Like I'm already thinking of that from that perspective of knowing how much my stuff from my past impacts things. But like that specific study with like the adverse childhood events, they were seeing like not just with mental health outcomes, but with risk factors like it playing a role in lifetime risk of having a heart attack, having a stroke, right? Like all the big killers. And so I'm like, of course, I'm like, of course I would take that into consideration when I'm approaching somebody's health, because it's like this thing says yes, like that, somebody's heart attack risk is not just dependent on their like status of their blood vessels, It's
Right.
dependent on, and like again, right, and I'm trying desperately not to like generalize um conventional medicine, because they've made a lot of strides in the things that they are actually consider lifestyle factors now, and it's not just about like, oh well, you're too fat and that's why you have the um
Right.
and so I know, like, no, do not have a filter. I'm like, I'm just phrasing the but yeah, and so like taking that trauma history into account and knowing it, and I mean kind of related to the the crass remark of like people saying you're too fat, but is like I do get a fair amount of people who like are like, oh my gosh, I'm struggling so much with my weight, and my initial interaction about that is like, if you're coming to me wanting this quick fix about and this quick weight loss, I am the wrong provider to see, because that's not weight. I hate obesity as a diagnosis because I don't feel like it's a standalone diagnosis. I feel like, and I'm sorry, I'm like tangenting on that. I'm like
No,
on a
no.
soapbox about this, but like so many
We
times, yeah, go ahead.
we love soapboxes here.
Okay.
So, and you're absolutely right, right? Because the general consensus is like the obesity is the problem, but really
hmm
there are other, even like mental health factors. Like, right? I would love
hmm
to be thinner, and I know what it takes. I know I need to exercise. I know I need to eat better. I know all of these things. I just can't get myself to do it, and that's different than just saying, well, you're fat.
Right, right. Well, and it's like, what's the chicken and what's the egg?
Right.
And then of course, like, so I have this joke about the chicken and the egg thing, which is, uh, neither came first. The T Rex did.
I
And
love that. I love
I'm
that.
like, well, when you watch a chicken go around, it looks like a little T Rex. Anyway, totally digressing. Surprise. But yeah, I mean, like, right. So like, so a lot of people will like go to the doctor and they're like, like, and if they're a higher BMI, right? Like they will get the interaction will be like, well, just lose weight. And you're like, okay, so I was saying I'm having these relationship problems and I need to lose weight to fix these relationship problems. I mean, obviously that's a, like but I like that has been said. I'm not
Yeah.
just like making it up out of nowhere, but like, that's one of the more extreme versions of like, okay, but like a lot of times where somebody's like, I have knee pain, I have this thing, I'm tired, and the first thing that oftentimes they'll be told is, well, if you lose weight, you're going to feel better. And it's like, well, like in order to exercise, I need to do this. And, um, I can't lose weight until I'm exercising and doing these things. And there are other aspects like, yeah, including that trauma history, including neurodivergence, that is preventing us from engaging in those lifestyle practices where we don't have the adequate support to actually do those things. And it's not because we're lazy or what are some of the other famous insults that we get, like,
Oh
of why we
yeah.
don't do the, oh well, we're doing it to ourselves, right? And we get like just blasted with shame, and I'm just like, um, but yeah, anyway, so like my feedback when people are coming to me about weight stuff is that I'm like, well, yes, I can help address like see if there's metabolic things that are going on that are off kilter, or hormones that are impacting this, or um whatnot, like thyroid issues, right? And address those components. But like, so with like respect to like the trauma history specifically, if your nervous system is in this constant state of that sympathetic activation, then that's going to offset the benefit of those other interventions, because it, like, one, it's like it's it triggering this inflammatory response, and then it's also like there's that feedback loop of like, what's the word I want to use? Evolutionarily speaking, like when we were in these high stress situations, like our more primitive parts of our brain is like, oh, we need to hold on to this fuel so that we can survive this. And so every time like we're getting stressed out, we're activating that same state, and like that part of our brain doesn't recognize the difference between the being in the desert and nomadic and being, in front of our boss that's yelling at us, right? So it's not like this life or
Yeah.
death situation. And anyway, so
I,
I feel
I
that
was
that
watching
was so tangential. Sorry.
No, it's all good because I was watching a TED Talk and I can't remember who it was, and hopefully the name will come back to me. But
Mm-hmm.
she was talking about how that response, like because of our, like you were saying, our our natural historical selves. The word escapes me.
Oh,
Um,
evolutionarily.
yes, thank
So,
you.
yeah.
That we've developed these skills to react when we're in the forest and we see a bear. But what happens if you have this reaction and there's no forest
Mm-hmm.
and there's no bear? And we still have that reaction even though the threat has been removed. We still have those indications and those things that we can't control that
Mm-hmm.
activate those certain parts of the brain. And sometimes it happens without any explanation. We don't understand it. It comes out of nowhere and it kind of derails your whole mental health for that day.
Yeah.
So, like, so taking that trauma history into account, then, like, and I know that one of the ways that you help with that is on how you communicate to people if they have a trauma history. How do you approach the communication piece with somebody that has a trauma history as opposed to somebody that doesn't have a trauma history?
Gosh. I mean, so it's not that I'm like walking on eggshells. I feel like people get that impression of like, oh, we got to walk on eggshells, or we quote trigger them. And I'm like, yes, like be considerate. It's not like this, like, I feel like there ends up getting like this dynamic in general. And again, like, I don't know if it's just like our population in general just like doesn't like being empathetic, or what is coming up. But um, when I'm communicating around that, I'm like I think this is where like my background in working in mental health really comes into play, is that like I will make sure that I'm understanding what I'm hearing from them, right? And so when they're, like sharing and it's hard, like without like those specific examples of like, here's this thing I'm this person I'm sharing, but where they're sharing whatever's going on, and then what I will typically do is that I will reflect back what I just heard and make sure that I heard it the way that they want it to be communicated. And so, right, so somebody may be sharing their story, and I'm like, so I just want to make sure that I'm tracking along with you correctly. And so what I just heard was, and then provide some paraphrase or summary of what they just said, and then I'll say, am am I with you so far? Is that correct? And then that gives them the opportunity to go yes, or like, oh, but when I said this, here's what I meant. And if there's still like, I will always seek clarification. And in the professional setting, like that works out really well. In a personal setting, depends on the person you're interacting with, right? Because I
That's
definitely
fair.
have some people that they're like, you ask too many questions. And I'm like, well, I'm just trying to understand, right? But it can come across in a personal setting. It can come across a little interrogative, right? They're like, what? Why are you hounding me about this? And I'm like, no, I want to make sure I'm on the same page. But in the clinical setting, right, like people are expecting their doctor to ask a bunch of questions, and so it fits right in. And they're like, no, I appreciate this. And So I hope that I'm demonstrating right now. I hope that I'm answering the question that you posed. Because
Oh,
oftentimes I will, like, somebody will ask a question, and especially when it's open ended, right?
yep.
All my thoughts about that topic will all flood in, and I'm like, okay, I think I'm answering the question, and then here's this other group of information that I had about this, and then I share that, and then I'm like, whoop, I just info dumped. So I hope,
The
yeah,
beautiful. Oh no, you're fine, and don't worry about that because I will interject and I will
yeah,
sort of help
yeah,
guide. And if I don't understand, I'll ask for further clarification.
cool. I love it.
Yeah. And I have to say, like that approach right there with the active listening for patients who are neurodivergent is a game changer. Because one of the problems that I run into all the time with my doctor, and I love him to death, is that he doesn't understand me and he doesn't ask for clarification about his understanding.
Mm-hmm.
And like you were saying, like you fill out all of these forms, and I'm going to an appointment hoping that I get to see somebody about my hernia, and ultimately we do something about my leg. And I leave, and I'm like, I don't understand how we got from point A to point B, but the reality is there's none of that active listening going on in the
Mm-hmm.
appointment,
Yeah.
and there's none of that pre-work in the appointment either of reviewing all of the paperwork. So I just think that's just awesome, Jamie, because that's
Thanks.
not something that you get in a normal traditional doctor setting.
Yeah. Can I use your example use that and say like what I would do in that situation, like as a
Yes,
provider.
please.
Okay, so
Yeah.
yeah, so if you're coming in and you talked about the hernia and somehow like the thing about the leg came up, what I would do in that moment of like the leg thing, I'd be like, okay, so I know that your initial thing that you came in to see me for today was about this hernia, and you just mentioned your leg, right? So I might go like there's a couple things that come to mind in that moment for me is like, is the leg issue related to the hernia? Because there's the inguinal hernia, right? That's in the groin. And I don't know. Sorry, I'm like wasn't trying to get invasive about
All
your
right.
personal thing,
Mm-hmm.
but right. So like in that example, if like so maybe somebody's experiencing inguinal hernia and they're getting pain that's going down into their leg due to it, and so it could be related, right? So in my example instance, right? And so, but I will say, okay, I'm hearing you mention this. I'm thinking that this might be related to this hernia, that if if it's the inguinal hernia. Um, and here's why I want to find out more about this leg problem, because of I want to see if it's related to the hernia issue. Um, if it's a hiatal hernia and for your that's where your stomach's going up, and to I
Which
don't
is
know.
where it is.
Okay, that's where
Yep.
it is. Okay.
Mhm.
And right, like I'm like, okay, well, what does that have to do with leg? And so in that instance, right, like I don't know, right, because you didn't specifically share like how the leg part came up into the conversation. But if like you mentioned it because let's say you mentioned it because the doctor's like, is there anything else going on or something, or
That's
like,
exactly what it was.
okay,
Is there anything
um
else going on? Yeah, my foot's kind of numb and there's this piece here. And he's like,
okay.
well, let's just drop the hernia and just focus on the leg.
Okay. And so in that case, right, so if it's like, oh, this came up in the what we call the review of systems, um, then I'd be like, okay, so, here again, like I'll say here, the initial priority was the hernia. You mentioned this leg thing when I asked if there was anything else. Do you want me to start also considering stuff to manage this foot pain? Or do you want to continue to maintain the focus on the hernia and address this thing down the line? Right. Or and again, if I'm thinking, oh, is there something going on in the spine, um, where somebody's got a disc issue, or uh, but again, the nerve the nerve that would be affecting the foot would not be the same nerve that would be affecting it's the one that's affecting going to be affecting the uh, visceral organs, right? Like that all that
Right.
issue is going to be higher up, but But maybe there's something going on, right? Like I'm like, here, how could this be related?
And
Right. So
and I
my
would have
brain,
loved I
yeah,
would
go
have
ahead.
loved to have that conversation with the doctor instead of just pivot, no discussion, move
Right.
to the next.
Yeah. So basically, like I'm saying, okay, here's why I'm still like zoned in on this thing. So I mean, and so for you, right, that would be an asset for you to hear all my internal thoughts of, okay, this is why I'm following this tangent right now.
Yeah,
Uh,
because then I'll
uh,
follow the tangent with you.
yeah, yeah. But
Like
yeah, it's
if it's
still
out of left field and I don't know what tangent you're going down, I'm gonna be like panicking.
right, because you don't have all the medical background of like how these could potentially be related.
Yeah,
And maybe they're not, or maybe they're both related to your trauma,
right.
right? They could be. Um, Not to say that they necessarily are, but um, yeah. So yeah, I'm like again, it's like kind of goes back to like I will always seek more information and clarification, and that's part of why I need to have those longer visits myself, is so that I have that space to do that. And that's part of why I work, I have a private practice and I'm not working for somebody else's clinic, is because so that I can I have to acknowledge the limitations that it makes for me, but it's a way that I'm accommodating my own neurodivergencies too, is that I'm like, here's how my brain works. I have tried to conform and force myself into that other box, and it was overwhelming. Yeah, exactly. Like, I was like totally burning me out, and, and activating my own trauma, right? Like, it's like, I'm not feeling good enough, and like, can I do this? And I know, right, like, and that ties into like imposter syndrome too. And I know, right, like I know that I'm intellectually capable of being a doctor, and I know I have the knowledge base. I know I'm smart. Um, I know how to problem solve, and the battles that I have around um around the imposter syndrome come from the internalized ableism, and that's like
Yeah.
okay.
Can
And
we
so
pause for a
yeah,
second?
yeah, go ahead.
Can you explain imposter syndrome for those
Oh
people who may
gosh.
not know? Because I know
Yeah.
so many people who are neurodivergent who experience, myself included,
Hmm.
imposter syndrome.
Yeah, I mean, if I were to summarize it, right, it's like that sense of not feeling good enough, and if of it not, I also like to, for myself, and I don't know if the general consensus on the definition of it, if people would necessarily agree with me, but for myself, it feels like it's this juxtaposition between your actual competence and your confidence, right? So there's like your competence is high, right? And that's what I think I'm convinced that's why I'm better in a crisis, is because in a crisis, you don't have time to second guess yourself, right? And you just have to trust.
I had an aha moment because of
Have
that.
your aha moment.
Yeah, I too am amazing in a crisis and like can function at a far superior level in a crisis more than I can on a daily
Hmm.
basis when I'm not in crisis. And I actually had to train myself to not cause a crisis for me to be in
Hmm.
existence. That was a tough one. That was
Yeah,
a tough life lesson for sure.
I know. Oh my gosh. Yeah, no, we do that so much where we're like, we turn something into a bigger deal because we're like, oh, now I know how to deal with this because now it's a big deal. It's kind of like
Right.
that comes up in it comes up a lot with ADHD, with like deadlines, right? With the procrastination, and people put stuff off till the last minute, and then it's like, oh no, I gotta finish this. I gotta turn this in by tomorrow or 5 o'clock tonight, and so it's like, and gets that like that dopamine kick, and um, yeah, that's what kind of what it reminds me of. Also, I feel like this is kind of the theme in our conversation, is like, that can have that overlap with the trauma too, of like,
Yeah.
oh, here's how we were living for however many years or weeks or months or whatever, um,
How
and
old were
so
you when you knew that you were neurodivergent?
when I knew or when I had it confirmed.
First, let's say when you knew, and
Like
then
when I
kind of go with
suspected.
when it was confirmed.
I mean, oh gosh, I feel like I say the "oh gosh" statement a lot too.
Oh,
There's like
you're
the
good.
"woo." Hey, at least I am not saying sorry excessively today.
Yeah,
Watch, I'll
because
start saying it a lot.
mine was very interesting, and I can go into mine first if that gives you
Yeah.
some time.
Oh, sure.
So,
Yeah.
because I was married at the time, and we're sitting on the couch watching a comedy show,
Hmm.
and he was talking about his son possibly being on the autism spectrum, and started talking about like the lack of eye contact and some of the other things. And I remember the wife at the time was looking at the show, and then she'd look at me, and then she'd look at the show, and then she'd look at me, and she
Hmm.
said, "I think you're autistic."
Hmm.
And I was like, "No, like what?" And then I took that online test that I don't know why the name escapes me, but it's the one that everybody takes.
The
Um,
rads are
no,
no.
there's like 50 questions. The autism
Oh
quotient
gosh.
test.
Okay. Okay.
So I took the autism quotient
Hmm.
test, and almost like there was 30 questions. I was a 27 out of 30, and so I'm like, okay, now I've got something here that might explain a lifetime of challenges that I didn't quite understand.
Hmm. Yeah.
That's how I started.
Yeah. Mine, well, specifically, okay, so I'll go like the general. Let's see if I can keep this relatively summarized. Good luck. Um,
We have plenty of time. Well, I do. I don't know about you. You're having practice,
I
so
do, yeah. I mean, my kid, the kids are running around, so like if they're like, "Mom, what are you doing?" Um, we'll have other guests on the episode. Um, but yeah, I think it's like my again that internalized thing showing up of like, oh, here's all the stuff that I've been told. Get to the point, Um, but yeah, so like my wonderings about neurodivergence. I mean, I'm sure like in elementary school, like oh yeah, like why am I having a hard time remembering the term? Twice exceptional to the two E kids, right? And so right, like I tested into talented and gifted, and back in the late 80s, early 90s when I was growing up, like we actually had a program. And so I got to do like a lot of independent study for academics or work in smaller groups. And so kind of had, yeah, I didn't have an IEP or a 504. Like I'm sure those existed back then, right? But I think it was more exclusive of a group that actually had access. I know that there was special education, right? Um, but like I know that in retrospect, I know I fell through the cracks as far as like the support for like the executive function side of things, and had to figure out a bunch of stuff on my own. But there were things that ended up being accommodations because of being gifted. I got that opportunity to work in smaller groups in a quieter setting that was like, we worked with like technically a tutor, right? But we're in like working on this advanced math separate from the rest of the classroom. That was in third grade. There's like a group of 5 or 6 of us that were like working with Mr. Pink in the back on like I think we got to do like fourth grade math, so it was like a level up, a grade up. And then the next year we had this we were in a mixed grade class, and so or not yeah, it was fourth fifth split, so when I was a fourth grader. And then I so they had this like challenge test at the beginning. This was still for math. They had this challenge test at the beginning of the year, and so I took the one that the fifth graders were
uh huh.
taking instead of the fourth grade one. And so then I got 2 years ahead in math, and so then I was working completely independently on my own out of my own math book all by myself, and like obviously would check in with the teacher and stuff. And so like yeah, so back then, like I knew I was different, right? I knew I was a nerd, and had my other friends that some of whom have been since diagnosed as neurodivergent as well, and others of whom like suspect that they are. And so kind of found the crowd where I fit in. And so like early on, right, like not knowing about autism or only knowing it in the context of like Dustin Hoffman as Rain Man,
Right.
you know,
Yeah.
or Temple Grandin, right? Those like very stereotypical examples. And then when I was, this was 2004, my oldest kid was diagnosed. And when they were like going through the criteria of like, this is why they're meeting diagnosis, I was like, not everybody does that. And so that was when I started wondering. I'm like, what? Not everybody quotes movies and conversation all the time? Like that was like the main one that would come up. I'm like, that sounds boring that you guys don't do that, right? Like,
Right.
um, yeah, or like little things that like, yeah, and then she does this like repetitive behavior. And again, I was just like, oh, that's abnormal, right? Like at the time, I was like, oh, this. Um, and again, like even though I was studying psychology at the time, it was still very like, oh, here's what autism is. And again, it was like use those, what would be considered level 3
Yeah.
uh, examples of like people needing very substantial support. And that obviously, like I was living independently and I was raising my own kids, and so I was like, how are we this? What? And at that time there was still so much stigma surrounding an autism diagnosis, and yeah, and I remember like when I was telling their grandparents, like getting a little bit of pushback of like, what? Our grandkid's not autistic. They don't act like Dustin Hoffman's character. What was his name? Raymond, the character's name.
Yeah,
Yeah,
Raymond.
yeah.
Hmm.
Um, and yeah, so I would say, what is that? 20 years ago is when I started wondering. And then, but yeah, I was diagnosed last November, so it's been almost a year. It was Veterans Day of last year that I got my official diagnosis, and yeah, actually, prior to that, I think it was a 2020 or 2021. I think it was 2020. Because it was before my ADHD diagnosis. I had actually done an autism assessment and like had met the part A, like part A, B, C, and D criteria. But then on part E, so part E is, do you have a condition that other explains your symptoms better? And that clinician was like, I think your trauma history explains this better, and I think you probably have ADHD. And at the time, I was like, I don't know what to do this. I'm like, I'm still convinced that I fall in this umbrella, but whatever, I'll do the ADHD thing first and then circle back around to this later. Because I even made a joke at the time of like, well, maybe you would believe I was autistic if I fought with you more about this belief.
That's possible. And that brings up a good point though. Like I know so many
Mhm.
women who have been misdiagnosed the first time around because the way that the test is structured, it's almost like they're testing for traditional male pattern behavior.
Mhm.
And they're trying to hold women to account towards a male standard. Of course, a woman is not going to behave the same way that a man is going to behave in certain situations. And so the entire test has been a huge disservice to so many women
Mhm. Mhm.
for that precise reason. Like I can't even imagine how you must have felt knowing kind of you're autistic and your person who tested you was wrong. There had to have been like a piece of you that was frustrated with that, right?
I mean, I didn't let it go. Like
Right.
I masked
Yeah.
in the moment of right. Well, and they said that too. They're like, either you're an amazing masker, and I'm like,
Yeah.
that should be the end of your sentence. Like, because we have to be. Um, yeah, and or you're not autistic. And like the other ableist thing that was said, that just like this was the part that upset me the most, was no one wants to be autistic. No one wants to live that way. And I was like, Yeah.
That's not what this is about. Like, I'm not. Oh,
They're
I
like,
hate.
what? Yeah. I mean,
Uh,
yeah. And then I was already a clinician at the time, right? So they were like, you have your own practice, you're married, you've raised kids. Like you're not autistic because you're successful. You're too successful to be autistic. And I was just like, so is my daughter misdiagnosed? Like,
right?
because that's where she's out now, right? Like, like, you know, she's at where I was at that age, right? Well, except she doesn't have her own kids, which, like, so I would say, like, oh, look how she's more responsible than I was, or that came out
Yeah.
weird.
No, but I totally get what you're
Yeah,
saying, right? And it frustrates me to no end to hear stories like this because it's so invalidating. And it's
yeah,
almost like they don't care about the repercussions of that. And it's like they don't even think about that. You know what I mean? Like, I, if people were more aware, they would not use such ableist language when
yeah,
talking to somebody with a disability. It's
yeah,
frustrating.
yeah. Well, it felt super gatekeepy.
Yeah,
I feel like I'm making up my own words, but I do that all the time, though. I will take
ain't nothing
like
wrong with that.
a regular word and like add a suffix that's like, I'm
Yeah,
like, I don't think that's a suffix that started out with, but it
but it works.
works.
Yeah. And
Um,
then, so what was different the second time around? Because then you got your second
yeah,
diagnosis.
yeah. The second time around, so I mean, I can talk about like the kind of the segue into that.
Yeah,
So I went and I did pursue uh the ADHD assessment after that because I was like, okay, well, fine, I'll go on this, take this exit, this off ramp, and go do this thing. So at least I'll have some part of the explanation, and then got that. I was taken aback that I got diagnosed with combined type because I was like, what? I'm not impulsive. And then they were like, yeah, so here's the examples of how your impulsivity shows up. And I'm like, oh, okay. So it doesn't always look like somebody that's going on a spending spree. The stuff that gets misdiagnosed as bipolar in a lot of cases. Um, where, yeah, like the impulsive decisions that like lead to money problems or relationship problems, stuff like that. It was like, you uh, make, it was basically like the choices. I have issue with the delayed gratification. So like, in like those the videos we had to watch in psych classes of like where they present the cookie to the kid and they're like, you can eat this cookie now, or if you wait until I come back, I'll actually give you another cookie if you
I'm
haven't
not
eaten the
waiting.
first cookie. I like,
I'm not waiting.
so basically like that, where I'll be like, but I know that it'd probably be strategically more beneficial if I waited to make this decision, but I feel like if I don't make this decision right now, I'm not going to make the decision. Whatever, like, and of course, if
Yeah,
it's like more enticing, it's like, oh, yeah, I want to do this right now. But yeah, I probably, it's kind of like, uh, to use like a really basic example of like, uh, so that's how they get you on the sales, right? It's like, oh, Black Friday,
yeah.
like, do I really need this TV? We already have two TVs. They'll probably last a few more years, but this one's such a good deal, right? I mean, I won't necessarily do that with a TV, but many people do. Um,
Oh, there's a reason I am consciously a minimalist.
mhm.
This is a newfound thing because I would just buy stuff all the time just to buy stuff. And so I had to teach myself to somewhat be a minimalist because you're right. I would have a spare TV in a box just in case the first one breaks.
Oh, this extra thing, yeah.
Yeah,
Oh, we need more blankets. We always need more
right.
pillows, right? Yeah. I know. I feel like I always like, as I tend to do it with practical things, like the pillows thing, right? Like, oh, when can um, and or yeah, or I'll have like semi hoarding tendencies of, oh, let's not throw this away. because we could reuse it. And then it's like, now we have this whole stack of like the shopping bags
Yep.
that we always forget to bring back to reuse, right? Like that whole thing. But yeah, no, my biggest where it still shows up is like, I'm like, ooh, this training course that I can take and it's like, well, I could save that for my CEs for next year. I don't need to do it right now. But yeah, I don't know. I'm like, well, so I'm like, yeah, but my stuff has better reasoning. It's like, no, it's still impulsive. But yeah, so that diagnosis, that was April of 21 is when I got the ADHD diagnosis, and starting getting like medication support around that, and but still like I was still like felt incomplete as far as like
Yeah.
uh what was explaining how I was experiencing the world, and so I like couldn't let it go, and I was like, that seems like with pursuing the autism diagnosis. And so, what ended up leading to that, getting that second assessment, is so because I didn't want to refer my own patients to that psychologist that I had the poor experience with, because I didn't want them facing that same
Yeah.
thing, that same outcome, and not just like, oh, they didn't get the diagnosis that they want, right? It's not about that. It's about
Yeah. You want to make sure you're suggesting a provider that is affirming and takes care, and you know they're going to be safe.
right. Yeah, because well, I guess the part of it was like, yeah, that safety thing of like emotionally safe, right? Like, because I knew,
Yeah.
right, like obviously, like that person's not gonna physically harm them, but like, um, because I knew that either they could have the outcome like I did of being told you're too successful to be autistic, or they could have the outcome where they do get the diagnosis from that provider, but like, you know, if that provider's saying you don't want to be autistic, nobody wants to live like that, that feels like there's like that underlying judgment of what that provider thinks of autistic people, right? So I'm like, I don't want to send people to this person. I do not like. I feel ethically like physically uncomfortable with that, and so yeah, so I started reaching out to colleagues of like, where are you sending people for assessment? Because my local resource is not. I'm not going to use that now. And so then they a couple of them had recommended the same place, and I was like, okay, I better look into this. And so then I reached out to that practice, and I am now working for them part-time as an assessor.
I love
um,
that.
yeah, so that was really cool. I wasn't looking for a job, but yeah, I was like, I'm looking for a resource to refer my patients to. And yeah, I'd seen like another colleague was working for them, was serving the Oregon clients. I have a license in Washington as well, and they were trying to like be accessible in all 50 states. And so I was like, and by the way, are you looking for other providers?
Yeah.
Because I'd also be interested in that. And so then, yeah, like I said, I ended up starting to work for them as well. So I got assessed by who then became my boss. Um, so that was really cool, and yeah, and it has been the best boss that I've ever had because she's so neuro affirming.
That's awesome.
Yeah, so not just in her assessment procedures, but in her like role as a employer too. So, yeah. The long answer to how'd the diagnosis, or when did you first suspect you were neurodivergent?
But people
Seems.
need to hear these stories, right? So much of that part or that piece
Hmm.
is not what's talked about in the media, and it's not what's talked about out there in modern society. They focus on shows like Love on the Spectrum, and that
Hmm.
only helps a certain number of people that have that particular type of autism. And so to hear stories of people and how they got through it and how they got their diagnosis, I think is very important, because I want people to see autism is not only everywhere, but people are thriving as autistic people in careers that you wouldn't expect.
Mm-hmm. Mm-hmm.
And representation is key, right? Because a lot of people, if they don't see a doctor who's autistic, think that I could never be a doctor until you've met a doctor that has autism and you're like, oh, I can also actually become a doctor.
Yeah.
And that in itself is so affirming because it's a narrative that just isn't out there.
Yeah. Well, and that you also don't have to be a savant to be a doctor
Yeah.
who's autistic, right? Because
Yeah.
that's the other depiction. Like, I watched the whole series of The Good Doctor. I was yelling at. I will yell at medical shows. I totally yell at medical shows because I'm like, ah! I appreciate it when they get the diagnosis right. Like, my favorite medical show to watch is called The Midwife because I'm like, yes, yes, that's right on. Oh, that one that has preeclampsia, right? Like, I'm just like, it's like when people watch sports, they're like, oh, duh, they should have made that run instead of the pass or whatever. Why didn't you give it to LeBron? Right, like, but I'm like, oh, no, like, have them flip over. They got shoulder dystocia. That baby's gonna get stuck.
Right.
But yeah, The Good Doctor, like, there were things about that show that I definitely appreciated, and like even like the depiction of autism, I feel like they got a lot of stuff like spot on, and did a better job compared to older shows, with the savant presentation and showed him like navigating, but I'm like, I have my thoughts about like how his character developed though too, because I'm like, you don't know if somebody would made this amount of growth with the specific support that he was getting. And but where they were showing him like navigating like relationships and friendships and like that social aspect, I appreciated that because like I felt like the like earlier shows didn't really touch on that. Everybody just had to adjust around them and like I don't know if you watched the Atypical, that one with
I watched the first episode.
Okay. Yeah. Yeah, the parents in that one. I was just like,
yep. That's kind of where I was going too. I was like,
but I love the penguins. The penguins. Yeah. Like Adelaide Chinstrap Emperor, right? Like that's. I do that repetition when I'm thinking about penguin. When somebody gets talking about penguins, I'll like do his. What was that character's name for that one? Anyway, but yeah, The Good Doctor. Yeah, I would yell at them of like some of their medical decision making. Like there was this one that was like clearly the plot line was to address the anti-vax movement, because like one of the characters, you know, that were the patients that time was this teen who was like 17 or something and hadn't been vaccinated. His parents like were the mom was anti-vax, and he ended up like what he ended up presenting with in the hospital and getting admitted to the hospital was like this infection, and they're like, well, we should start getting your vaccines on board too, because clearly you're prone to these you're like getting these infections because you weren't vaccinated. And I'm like, okay, first of all, I don't think the infection was even related to vaccine preventable illness in that episode. But like the thing that I like yelled at the TV about was the fact that the first vaccine that they were going to start with was one of the ones that uses a live virus. And I'm like, you got this dude fighting off an infection and you're going to start with the MMR? Like, what, maybe start with DTaP or Tdap, or, you know, like, it would be Tdap because if he was a teen, it's that one that's given after when you're older. But yeah, I was just like, we're going to start this vaccine series. Start with one of these other ones. Or Hep B, right? Like that's a one that you're at risk for exposure in a hospital setting because of potential cross-contamination with needle sticks. And anyway, right. So I'm like yelling at it because I'm like thinking about this from like this practical standpoint. And I know I'm like on this total tangent of this, but yeah, I mean, like, I don't know, but it comes back to that communication piece of like, this is why I'm making this medical decisions. And so I'm like, depict it accurately in these shows. I'd yell at House a lot too.
Oh,
I'm like, how inappropriate.
but I do want to circle back
Mhm.
because we've been at it for an hour.
Yeah, yeah.
Yeah, and I want to circle back to the naturopathic piece
Mhm.
because I want people to understand better the role of a naturopath versus a traditional doctor. Because so many of us have adverse reactions to medications,
Mhm.
and so many of us rely solely on just medications to help with our symptoms. And so, talk about the difference between like a traditional MD and a naturopath's approach to medicine.
Okay. Yeah, so kind of backing up to earlier, like when we were talking about how like our main way that we approach a case, right, like a symptom presentation, or diagnosis is so like I mean, we're trained, obviously, like we're trained to analyze like symptoms and like and formulate diagnoses, right? And we're trained to order labs and use those to inform our diagnoses and our treatment plans, and in the same way that any provider would be, right? Like the conditions aren't different depending on who's treating it. Like the condition,
Right.
right? Like pneumonia is pneumonia regardless of who you're going to see to get it diagnosed, or herpes is, sorry if that was the example that I was using, but or you're the hiatal hernia, right? Like that's
Right.
a hiatal hernia no matter who is diagnosing it. The difference comes in of like how we're approaching the treatment and how we're looking at how the situation happened in the first place. And so like so the pneumonia example, right? Like your primary care may or may not go, what is leading to the, you know, I mean, they'll do it to the extent of, oh, you were exposed to illness, an infection from somebody else, and it developed into pneumonia. You got a respiratory illness, and then it escalated into and infiltrated into your lungs, right? And so they'll look at it, but if I feel like they tend to, and again, I don't want to generalize to like all conventional doctors approach it this way, but where they're just looking at the acute or subacute situation that's in this more confined timeline. Whereas
Yeah.
for how I was taught was like, okay, this person developed pneumonia. Does this person tend to develop pneumonia? Right. So I'm going to treat the issue in front of me. Right. So I'm like, oh, this person's been sick for 2.5 weeks. It's escalated into pneumonia. Yes, I'm going to recommend an antibiotic at that point. Like, even though I'm a naturopath and like I'm supposedly anti-drug, I'm not anti-medications, right? There is a time and a place. You know, somebody being 2 days into their illness, especially if it's not down in the lungs, I'm not going to be like, go on this antibiotic with your second day of
Right.
symptoms, right? Um, if it's down into the lungs and they have a history of pneumonia, I might consider that. Apparently, I just gave a thumbs up because of my gesture. I don't know if that showed up for you. I do that a
It's the
lot.
first time I've actually seen that. So
Zoom thinks I'm raising my hand all the time because I'll be like, I don't know. And yeah, so like the pneumonia thing, right? So like I'll be like, oh, okay, this person has pneumonia. Do they have a tendency to escalate into pneumonia every time they get a respiratory illness, right? Like we could also use my recurrent sinus infections that
yeah.
what got me interested in the field to begin with is like, yes, yeah, you address the issue in front of you and resolve that, but you also aim to keep it from recurring or limit the amount of recurrence that it has. And so, yeah, if somebody's prone to pneumonia or somebody's prone to sinus infections, why do they keep getting these? And so in my case, with my sinus infections, yeah, I kept getting, my immune system was shot because I was overworked, I was under high stress, and I was getting exposed in this confined workplace, right, in an institution where plenty of other people were going to work sick, and the patients, right, like, uh, they're institutionalized, so they're not getting out. They're going out to the yard occasionally, like, even if they're going out daily, right? They're still living in this confined environment where that has
And the
a,
disease is just going around and
yeah,
around and
yeah,
around.
it's a much more high prevalence in settings like that, and so like it's that those mix of factors that like increase the likelihood of that happening. So you have all those those factors that are outside of me. So I mean, obviously my suppressed immune system was in me, but like those other environmental factors that raise the risk, and then the host factors that for me were raising the risk were um, the amount of stress I was under, and therefore the relative suppression of my immune function. And then I also had this like inflammatory issue that in my sinuses that was further exacerbated by the environmental factor of the food that I was consuming, because of my immune system reacting to that and creating antibodies, an antibiotic, or sorry, antibody and inflammatory response to those foods, um, that is not supposed to happen. And so, right, so we're addressing it from multiple standpoints of, right, so again, like our field approaches that and they go, okay, what can we do to address those different components? Can we do things to change things in the workplace? No, we can encourage people, maybe look for a different job,
Kind of,
right?
yeah.
But, that it's a privilege to be able to look for a different job, right? To be able to change workplaces. And then we go, okay, what other factors? What can we do? What can we do to support this person's immune system, both from the aspect of supporting its resilience against infection, right? So can we do things that are encouraging immune function? Can we do things that are antimicrobial, that if the person's getting exposed to this infection, that particular herb might be enough to wipe it out? Um,
Okay.
do we the component of my food sensitivities, right? So that was addressed in like, okay, let's cut back on those or cut those out and reduce that as playing a role in the inflammation. And
Can I pause
yeah,
there
go
for
ahead.
a second?
Yeah.
Because I think a lot of people don't understand there are certain foods
Hmm.
that cause inflammation, right? Can you kind of elaborate on certain foods that people should possibly, because like especially if they have these, like I understand I want people to see a doctor,
Yeah, yeah, yeah.
but there are some foods that people should just probably not consume if they can avoid it because they're so inflammatory, right?
So, I think so. I think this part is like highly influenced about by my mental health training, and
Yeah.
especially because I did a lot and got specific training with regard to management of addictions. And so I tend to approach things from this harm reduction standpoint, in that I am, like somebody can go on a full elimination diet, right? But
Yeah.
sometimes
That's
that's
hard.
right.
It's
It's
hard.
hard for anybody, right? And
Yeah.
sometimes that's way too restrictive, and sometimes that's restrictive in so far as it may be contraindicated for somebody, because maybe somebody has a history of an eating disorder, right? And so the risks of that eating disorder being triggered, and I hate that word, like, is so
Yeah.
overused, right? But activated, right? Like that's a word I usually use to substitute, but like getting bringing flaring that back up, right? By right. So let's say like somebody with a history of eating disorder. So again, this is how like the trauma history informs my clinical decision making. So let's say somebody with that history, had is like, I keep getting these recurrent sinus infections. And they're like, can we do some food sensitivity testing? We do some food sensitivity testing, and it's like, oh yes, you're reactive to dairy and wheat and soy and eggs. Those are like four of the top five. Which one am I leaving out? Corn, I think it's those are also like the top five like allergens.
Okay.
So an allergic response is different from the food sensitivity inflammatory response. They're different antibodies that are play the role in each. So an allergy, it's the IgE antibodies. I know I'm like adding
No,
additional
no, I appreciate this. I
pieces.
really appreciate this.
Okay. So it's IgE antibodies that are involved in an allergy response, and then the sensitivities, it's IgG antibodies, which are the same antibodies that are designed to respond to infection. Funny enough, um, and
Okay.
and then there's food intolerances, which is yet another category, and that's when you don't produce sufficient level of enzyme to break down those foods. So the most common example is the lactose intolerance. Um, and then what breaks down those foods instead? Your gut bacteria. And then how do they usually process things? Through fermentation, which leads to gas and bloating and diarrhea. And anyway, but that's a whole
No,
separate
thank
thing.
you.
But
No, they
um,
really appreciate that level of detail. You have no idea how much people will
okay.
appreciate that.
um yeah, so like with so like how I respond to like the food sensitive. So right, the question you asked was like about the inflammation and about these food sensitivities, and uh if people should avoid these foods in general. And so this long story is to say, I don't blanket statement telling
Yeah.
people to avoid the foods, right? I will say, even if somebody has those foods show up on a food sensitivity panel, even if we know that those certain foods exacerbate their symptoms, I'm measuring it of like what, it's kind of like voting of like what's the least evil of the choices, right? Sorry. I feel like we're too close to November 5th for me to not make a comment. There's no good
But
choice, but there is
but you're
definitely a worse
absolutely
choice.
right. And,
And so
and
yeah, go ahead. Oh, sorry.
no,
Oh,
what I was going to say is that, and that sort of goes along with this whole concept that I've learned over the years, that just people don't like being told what to do,
yeah,
even
yeah.
if it comes from the doctor. And a lot of people, especially on the spectrum, have this rejection sensitivity or have
Mm-hmm.
this
Or the
anti-authority
PDA.
approach.
Yeah,
Yeah, or
where
PDA. Yeah.
yeah.
And so I appreciate that distinction about not telling them what to do, but giving them that informed,
Mm-hmm.
giving
Mm-hmm.
them information and giving a person the power to decide with the information, as opposed to a dictatorial relationship where you're
Mm-hmm.
telling them what to do, is a huge difference.
Yeah. Yeah, and I mean, I guess it gives yet another example of like how my communication is different, and it's not like, and I feel like that this example is more of because of my neurodivergence, how my communication is different versus because of their neurodivergence, how I'm tailoring it to, like, like I kind of said at the beginning of like, I don't know that I'm necessarily going, oh, this person's ADHD or this person's autistic, I better talk this way. It's more of a, oh, I don't have to filter myself as much and try to translate to neurotypical, um, and can just talk how I
Which is,
talk, right?
and
Which
people don't understand how much work that is to translate into neurotypical.
it
It's so
seriously feels. I took
hard.
2 foreign languages when I was in high school and college, and so I feel like I took them in the wrong order. I took German and then I took French, and I feel like I should have done it the other way around, because German, you're like pronouncing every little syllable, every single stinking letter, and then French, you're like, this a word is spelled so to be able to, I think yeah, is pouve or pouvait, is like the infinitive version.
Yeah.
But like if you're saying they can, it's what is it? or we can, right? We can. Um, I know I'm like trying to remember the conjugation, but it's like, uh, uh, yeah, it's vous pouvez, but it's Peuvent, right? And so like you're leaving, I've you know, if somebody
It's more
is,
efficient.
I'm like, if somebody's listening and actually speaks French, and I'm totally screwing this up, I apologize, but um, like,
I took
ah,
German
you're
in high
trying to.
school and I remember like 5 words.
The
So
German, yeah, my favorite German word is die Geschirrspülmaschine, which is my least favorite chore. It's the
washing
dishwasher.
dishes.
Yeah.
Yeah.
I'm like, I should like it because it helps making washing dishes easier, but you still have to load it. And, like, you know,
Yeah.
if somebody always has their preferred way of loading it and then is like, why'd you stack this? Yeah, anyway.
I hate
But
dishes just because they're never done.
I know. And they're always,
Like
yeah,
it's just like I just want to be
it's
done and
never
not do it
ending.
again.
It's like, that's the same with eating, though. Like, you always have to eat. And
Yeah.
like that feels like a chore sometimes too. But yeah. But yeah, like translating from neurodivergent to neurotypical, or interpreting the input from neurotypical to neurodivergent, right? Like, and like going, "Ugh," you know, so there's that extra step that's having to happen. And so that's why, like I was joking earlier about like, um, you know, I serve this population because we're underserved, but also because I prefer talking to people that I don't have to do that extra step with, which um, obviously I'll still work with neurotypical people, right? But yeah, I don't know. I feel like I left that other explanation about like the um, approaching the food inflammatory response. Like I felt like I left that incomplete of like what I said
Kind of.
about that.
So where we broke off is you've got to the point where you're talking to them about harm reduction.
Yeah,
And
yeah.
then
So like I was using that case of like, okay, there's this person with this eating disorder history, and so I will, you know, I'll be sharing like these lab results of like, okay, so we see like these four foods were, you know, usually people have a handful more than that even too, but that these had this heightened inflammatory response. And so then I will say, I know, you know, from reading your history and us talking about this in a, you know, your intake appointment, is that you do, I know you do have a history of anorexia or bulimia or whatever, you know, and so I, you know, and I will have discussed this even prior to the testing, but so like, so and upon sharing the lab results, I will say like, yes, like a lot of times are like what will end up being recommended at this point is an elimination diet, but I do want to be considerate of your history of your anorexia, and so I'm not going to tell you that's what you have to do. I'm What we can do with this information now is that you can make an informed choice when you are eating something with these foods as an ingredient, or when you're eating something that's like the main ingredient of it, or like, you know, it's scrambled eggs or something, right? Like um and you can make a more informed choice about which things you are going to eat. And again, maybe that's still bordering on that level of like activating around that eating disorder. But you can at least use that information, right? So that, like, one of the things I'll say is like, you don't even have to change your what you're doing with regard to like, you don't have to stop eating these foods
right.
at all, right?
Yeah.
And I'll say, what you can do though is it gives you more information around what you can do around planning it, right? And so if you know, oh, I'm going to be eating this meal that has these ingredients that are going to flare up my symptoms, and then you can plan for your recovery, right? And so you're like, oh, okay, I know when I eat this, I'm usually kind of like symptomatic for the next 2 days. And so maybe you change up how you're treating those days, you know, like, oh, maybe you eat this meal heading into the weekend so that you don't miss work, or maybe you take Monday off, or right, if you can, again, like if you have the privilege of having a flexible schedule like that, or things, or Or I will joke at times of like, if you're trying to get out of something, maybe you strategize eating that thing heading into that. So, oh,
Yeah,
I'm sorry. Gosh, I just,
I
I
love that.
like having your symptoms show up when you see this
And
is like that's the autistic informed, like, I don't want to go to the social event. And
that's exactly where I was gonna go.
yeah.
Actually, I appreciate the distinction because like I filter my social activity based on that sort of a thing, right? Like I have Sunday off to recover. I can do
Hmm.
two parties on Saturday, or I can do this on Thursday if I do this and sacrifice on Friday. And I find that is more beneficial than just cutting things out.
Hmm. Hmm.
Because sometimes I just want ice cream.
Yeah. Yeah. Yeah, so I'm not going to tell somebody to stop eating ice cream. And
Right.
like even in those, like, somebody trying to watch what they're eating to for their weight, right? For examples, I will say that I'm like, if you, especially if they have like the history of like the yo-yo dieting, I'll be like, don't totally. My advice is to not totally restrict yourself from treats, because what's going to happen, what it sounds like has happened before, and this happens to pretty much everybody, is yeah, exactly. I'm like, oh, me too. Um, is that you'll be like, oh, I can't eat this. And then when you eat it, because especially like with the delayed gratification issues, um, is that, and then you beat yourself up for about it, right? And so I'm
Or
like, yeah, or
or what
what?
I do is like I'll open up a bag and I'll say, well, I'm eating chips now. Screw it. I'll just eat the whole bag. I might
Mm-hmm.
as well since I'm doing this already.
Yeah, yeah. And so like again, encourage people to be more mindful, be more proactive in that. Yeah, I know that this thing is going to this I'm going to a wedding, for example, right? And
Yeah.
instead of being like, "Oh, I can't eat the cake," um, to be like, I'm eating that dang cake, and not like having to punish yourself as a
Yeah.
result, to be like, I'm gonna eat this cake, right? In the case of like the food sensitivities, oh, it's gonna make me symptomatic, and I'm gonna take these other days off or whatever. I'm gonna take it easy. But or in the case of like, oh, I'm trying to eat a clean diet. Again, I like some of the phrasing we use on these things. I'm just like, like this brings in a morality to it that I do not like. Um, but right, like I'm
Yeah. Because
trying to
that's
eat a more whole food diet, for example, right? Like, sorry, go ahead.
yeah. And diets and eating, that's an individual journey, right? So
Yeah,
I
yeah,
get what you're saying. Like you don't want to be one way or another about it because really it's up to that person and their desires, their wants, their beliefs. And I appreciate that you have that approach of not trying to change people's belief structure or trying to change the way people do. It's just
yeah, yeah,
informing. And like I said, just giving people the power is, and I have said this before and I'll say this again, without shared power, there cannot be any peace in this world. And so anytime somebody who has that power dynamic and shares that power with the person that would otherwise not have power, it sort of leads the way to more meaningful conversations, but then also more productive results. Because I would imagine, and correct me if I'm wrong, when you take this approach, you have patients that trust you and you
hmm
have patients that listen to you and appreciate that level of feedback and that level of thing. And that's uncommon. And I think it ties back to what you said in the very beginning, right? 90-minute appointments where you have actually time to talk to your patients. That's huge.
hmm hmm Yeah, and I mean, even my follow-ups are like, I do an hour usually,
Yeah.
and like if it goes a little bit over, I actually schedule in a half-hour buffer after my appointments. So like in the event that, right, like there's a couple of us, especially like ADHD part of like, here's this tangent and that's one, um, and where I'm like, yeah, okay. And so like, so it gives that little bit of wiggle room, so it's not like back to back of like, oh crap, I gotta go, right? That it's like, so like if even if it does end on time, there's that time for transition. And again, that's like the uh effect. What am I trying to say? It's it's serving as my own accommodation for myself too,
Yeah.
right? So that
And
it's
at the same time, it accommodates everyone else.
yeah. Yeah, and I don't like I just like again, like it was I tried working in that other set that standardized setting and I just like it just left me feeling like it totally exacerbated that imposter syndrome part because I'm like, why I can't do this? Why is everybody else able to do this way and I feel stupid or or feel like I'm not good enough or like I chose the wrong field or and it wasn't it was always about the logistics part of it. It was also it was always about like that administrative piece of it that was like
Yeah.
you need to do it this certain way and within these parameters, which means your brain has to function that way. And I'm like, my brain's never functioned that way. And, and so, yeah, that's why, like, again, total privilege to be able to work
Yeah.
for myself. And I know that, from like a capitalism standpoint, right? Like, I know that, if I was better able to conform to that structure, like yes I could be making more money but that's not what it's about for me, right? Like it's a like obviously like any job we have to make enough money to like put a roof over our heads and support our family and stuff, right? But again,
Yeah.
capitalism. But like for me, like working in this field, working being a healthcare provider is not about making the big bucks and that piece. It's about what I can offer to who I'm serving, right? And like again, like what we said at the beginning, when I like was saying the people I work with, but or I can't remember how I actually ended up phrasing it, but I was like, oh, I almost said the people that I work for, which is
Yeah.
true though. It's like I'm in service of the patients. I'm not there to show up and tell them what to do. Um, I'm there to show up and share my knowledge so that they don't have to go to med school to help their health,
Yeah.
and live their best lives. And yeah, and again, I think that's a other component of being neuroaffirming is that I'm not, like you were just saying about the RSD and the PDA and YMCA. No, I'm just kidding. See all the
Right.
acronyms. But
But I think
like,
that's
yeah.
I think it's an important thing to talk about, though, right? So, like, I remember in all of my jobs before I was diagnosed, the reason I had imposter syndrome is because I was legit masking. So,
Mm-hmm.
like, when I was the manager of instruction at a college, I went to work every day playing the role of a manager of instruction. I wasn't myself as the manager of instruction, I was playing a role. And all of my decisions weren't based on my own decision making. They were based from this lens of what would a manager decide in this role.
Mm-hmm.
And it was exhausting and I burnt out. Contrast that to the job I have now, which is amazing. I can just be authentically autistic at work. It's different. It's so different. And like you're saying, like on the capitalist piece, like the reason I do this podcast is I don't intend to ever make money out of this. And if I ever do make
Mm-hmm.
money out of this, it's going to charity. It's not going to my pocket.
Mm-hmm.
And I do this podcast just to inform others. Like I don't care about the rest of it. I don't even care if it blows up or if it's successful. I just want a resource where people can
Yeah.
digest information about this kind of stuff. Because right now there's very limited long
Yeah.
form discussions about this stuff.
Yeah. Yeah. Well, and that's exactly the reason why when you were like, "Hey, do you want to come on here and have this conversation?" I was like, "Yeah." Um, and I mean, and that's what I do in my job too, right? Like it's like I want to info dump,
Yeah.
basically, right? Yeah, and I appreciate like other people joining in, and yeah, like it's like, um, yeah, when you something came up when for me when you were sharing the contrasting experiences with the jobs is that and again I feel like this ties over with my like preferred population that I like to work with is like that's where I'm observing that I do still show up masking is when I am interfacing with the neurotypical population. And it's not even that they're necessarily coming in and like asking that of me of like act like me, don't act like yourself, right? But it's
It's
like it's
involuntary.
yeah, it's that pressure I'm putting on myself because I'm like, oh, this is a neurotypical person. I should probably hide this about me, or I need to rein this in, or like I'm gonna inconvenience them, or I'm gonna annoy them, or whatever. Again, right? Like all that. It's like, um, yeah, like, and yeah, like my like wish for everybody is to like be able to show up authentically all the time, and you know, I wish everybody like I wish it was safe enough to do that everywhere, right? And I'm like, why can't it be?
I, and I've searched long and far for that answer.
Mhm.
Um, I don't know if we'll ever get there.
Yeah.
Uh,
Yeah.
that's the sad reality. I mean, like, I would love to be able, like, I can now be authentically autistic everywhere I go because I don't care that people treat me differently. And that's the reality. Like, every time you disclose you're autistic, if unless here's the thing that I have realized over the years, if you disclose you're autistic to somebody else who is autistic, they will not treat you differently. They
Hmm.
will just treat you the same because they get it. If you tell somebody who is neurotypical that you're autistic and they can't help it, they will always treat you slightly different.
Hmm.
And
Yeah.
I don't know if that will ever change. I hope it does, but it's a pattern that has repeated itself time immemorial.
Yeah. Yeah. I feel like what shows up in the autistic to autistic interactions is that it actually serves as the relief to the person you're disclosing to because they're like, "Oh, wait, I don't have to do the translation thing?" Like,
And
"Oh, I
it's
can
so
do it."
freeing. That's
Right?
so
It's
freeing.
so it like lets you both off the hook. Uh, like so like even if you were like, "Yeah, I can't sustain masking anymore." And but yeah, you saying that piece of like, "I'm autistic, I'm not going to be able to mask. Here's how I'm showing up." And then, yeah, you're saying it to like, you're saying it to me. I'm like, oh, good, right? Like, I was expressing my own thing of like, oh, good. I don't have to,
Mhm.
and I can show up. And yes, like throughout our conversation, I've observed many times where I'm like, the ableism, internalized ableism creeping in of like me going, oh, I'm talking too long about this thing and including all these details and being slightly apologetic. And you're like, you don't need to be apologetic. It's fine. This is how a lot of our brains work. And it's probably entertaining I hope it is. At least
100%,
informative.
Jamie.
um, yeah, yeah. I mean, I could talk all night, right? Like, like it's like my special interests. Um, yeah. But yeah, obviously, I definitely always want to be considerate of other people's time and like, I don't know, like, do you want me to try to wrap up now? Because I know like we've been talking a while now.
Yeah, actually, I was going to say we've been at it for an hour and a half.
Mhm.
And I would love to have
That's the
you
90
back.
minutes. My 90
Yes.
minutes.
And I would love to have you back to talk about like the intricacies of the assessment piece
Hmm.
um,
Like how
when
I
we have the
approach
opportunity.
assessing. Is
What's
that
that?
are you speaking to how I approach assessing, or are you talking about my experience as the patient client side?
Like, what can people expect from an evaluation? What
Yeah,
are
yeah.
certain things they should be considerate about? What are some things they should prepare for? And sort of that kind of conversation, if you don't
Okay.
mind.
Yeah, no, I don't mind. And I definitely I if yeah, I mean, I definitely want to contrast like how I and then the other practice that I work for how we tend to approach it, and but also, I mean, I kind of alluded to it when I talked about my bad experience of how it can show up in those other settings
Yeah,
that
and I
are
think those are equally important. So
yeah.
let's do that.
Okay. Okay.
Jami, it's been a pleasure.
It's been a pleasure. Thank you for allowing and creating the space and
Oh, you don't
um
have to thank me. Thank you. Like,
yeah.
this has been amazing. I've learned so much,
Oh,
and
okay, good.
I can't wait for us to do this again. I know we took a quick break, y'all, but I totally, in my excitement, forgot to ask how people can get in contact with you because you're such an amazing doctor. I think you need to promote the heck out of where they can find you as a clinician.
Okay,
So,
I guess
Jami, how
so.
can people find you?
Self-promotion.
Yes, it's
Okay.
important.
So if you're trying to find me in my private practice, that is my practice is called Naturally Healthy Families of Central Oregon. I'm based out of Redmond. I actually do not have a full-time office. I am a mobile-based practice, so I do mostly telehealth visits, but do also local. Obviously, I'm not going to drive across the state, but I do
Right.
local house calls, home visits, which a lot of I take insurance and like all the insurances so far, including OHP, um, covers. Yeah, covers those home visits. So, yeah, like I had a family that recently they had a baby, and so we are going to do the baby's newborn check. Well, 2 week
Oh,
checkup
that's
at
awesome.
their house. And then I'm also going to see the older siblings that day too. Um, so yeah, so in that setting, and I can't remember if I mentioned earlier on that. Oh yeah, I did when I was talking about the other practice. So
Yep.
I'm licensed in Washington as well. So obviously that's telehealth. I'm not going to drive up to Seattle and do a
Yep.
home visit in Seattle, unless I'm already in Seattle. Um, and I'm licensed in Vermont, and so can do telehealth over there. We just have to take into account the time zone difference,
Okay.
with that being 3 hours ahead. I have a website. Is That's probably the easiest way. I have one of those like fillable forms, so to
Oh,
speak,
perfect.
on the website that's like put your information in and what you and it has a little drop down menu, and so I think the drop down menu options are like, do you want to be seen for support with neurodivergence, uh complex trauma, I think it was another one I put in there. I think the other one, it says like family mental health, so it was kind of using that as an umbrella term for any other mental
Yeah.
health that wasn't addressed by the other ones. And I also do provide hormone support and lab support around gender transition, right? So
Oh,
like if
nice.
yeah, so if people are seeking that support, transgender healthcare, and obviously like healthcare otherwise for folks who are transgender as well, because it's not just about the transition part, but like obviously like
Yeah.
if you're transgender and have other hormone balancing stuff that you want to work on, or like thyroid, which is a hormone, or sleep issues, or right, like all those other things. It's not like, oh no, you can only see me for the hormone
Right.
transition support. But and then so that yeah, so the website is naturallyhealthyfamilies.com. And then with the other practice that I do, the autism and ADHD assessments at, I was talking about earlier, that is adultautismassessment.com. I'm like, now that I'm saying it, I'm like, I want to make sure that that's the actual, I'm like typing it into my, yes, adultautismassessment.com, all one word. Okay. I
Perfect.
was like, I'm reciting it. And like, now I'm like, was there underscores or anything? Yes. No, it's just all together. Adultautismassessment.com. And that one, like, if you're trying to schedule through that, I'm mainly working. There's another naturopath, Dr. Laura Weldon, who serves Oregon clients, but I do the assessments for Washington and Vermont through them. And
Perfect.
so that yeah, so that one you get in contact with Megan is the contact person there to get those set up. Do you need phone number? I mean, phone numbers are on those pages, so
Yep.
that's
Just the
easily
websites are fine, and
okay.
people will find you.
Oh, do I need to
Thank
do
you,
like
Jami.
Instagram and any of that? Those are
Sure.
on there too, but
You got it.
I think
If you
mine.
want, that's up to you. What's your Instagram handle?
I know. I'm like, what is my Instagram handle? I think it's at Naturally Healthy Families.
Okay.
I know. I'm always like, what is? Yeah, yeah, Naturally
You
Healthy
and me
Families.
both.
Um, yeah, and I think I'm on Threads technically, but I'm not. Like, I'm a millennial, elder millennial, so I'm not really on Threads. Like, I have a Threads account, but I'm
Feel
not on
that
it.
way about a
I'm
lot of
definitely not on X. Um, and again, you probably guessed from the earlier statements about politics why I'm not on X. Have I said too much?
no judgment there. All
Cool.
right. Thank you so
Thank
much,
you.
Jami.
All right.